This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. We're at Aurora Health Center in Oshkosh. We're in the OB/GYN department. We're here today to discuss the birth control procedure called Essure. Joining us now to discuss the Essure procedure is Dr. Sean Laibly, an OB/GYN doctor here at Aurora. And doctor, let's just talk, what is Essure?
Essure is a permanent form of birth control that acts to create a natural barrier for women against pregnancy.
And how does it work?
It works rather ingeniously. The procedure involves placing a very soft, what we call micro insert, which is a piece of material, into the fallopian tubes. And then over the course of about 12 weeks, the body forms scar tissue in the fallopian tube, and that will eventually then lead to complete blockage of the tube, and the sperm and the egg cannot pass through, thus providing a permanent form of contraception. Permanent
form, can people trust it?
You know, that's what I think is so exciting about the Essure procedure. In the clinical trials, it's been proven to be 99.8% effective. And what that means is that over the course of the 4 years that they've looked at this procedure, once they've proven that the fallopian tubes are blocked, there's never been a proven pregnancy. I think that's what's so exciting about it, because it's so far the best form of contraception that we now have available to us.
So a pretty high level of confidence on the patient's part and in your part, but is there a way to confirm that test?
Yeah, that's a great question. At that 12-week mark, which we expect everyone to come in for, that's a very important part of the counseling when someone undergoes the procedures, that they need to come in at the 12-week mark after the procedure is completed to have what's called the Essure confirmation test. It's a process that involves a simple x-ray and injecting some fluid into the cavity of the uterus to make sure that, number one, we can see the coils in the fallopian tubes, and number two, that we do not see fluid pass out through the fallopian tubes. Once we see that there's complete blockage, we're very confident that this procedure has been effectively done.
You described the procedure a little bit. It can be a little bit intimidating when you first hear about this. Is it a painful procedure?
You know, pain is kind of a relative term, and you have to be respectful of that. But it involves using a very small camera that the procedure is done in the office. The camera is passed into the cavity of the uterus. The coils are inserted, and then the camera is removed. It takes minutes to do. And in all of the trials that they've done, most women have compared the level of discomfort to that of a mild to a moderate period. We ourselves do a 24-hour follow-up, and that's what we have found to be true in our practice as well. And that, to me, is probably the most reassuring piece of information I give to someone that when they first come in and want to learn about the procedure. That it's really, according to most of their peers, it's not too uncomfortable.
Dr. Laibly, we appreciate you taking some time to join us today.
You're welcome. Thanks for having me.
And now we continue our discussion on the procedure Essure. Dr. Holly, another OB/GYN doctor, has joined us here at Aurora. Dr. Holly, let's talk a little bit about the recovery time of the Essure procedure.
The recovery time is really very short. We do the procedure here usually in the office, and they go home shortly after it's done, and they may take a day to recover if they have some cramping, but certainly within 1 day they should be fully functional.
Now, if a woman has this procedure, is it reversible?
No, it is not. It is considered a permanent means of contraception.
Now, if a person goes ahead and has this procedure, how does it affect the menstrual cycle?
Because it is non-hormonal, it should have no effect on the menstrual cycle itself. The timing should be the same, the flow should be the same.
Okay. And is this procedure covered by insurance?
It usually is covered, and what we do is we tell people to check with their insurance company just to make sure.
Okay, Dr. Holly, thank you for taking some time with us today.
Thank you very much.
If you'd like to know more about Essure or to schedule an appointment with Dr. Holly or Dr. Laibly, call the Aurora Health Center at 920-303-8700. I'm Ted Stefaniak. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.